or somebody wanted kind of a real case study. So Raja sir has been kind enough to present it. Can you please explain this case and why you wrote all these things, and can you please guide us through this?
See, very important thing is Roginama, that is a name. We need to have identification. So there will be some MRD number, that is medical record registration number, and medical record document number. Then age of the patient has to be kept in mind, because it gives a lot of information about the type of Agni you may be, and what is the position of doshas in him, because he is in Madhyavastha and all these things. Then Linga, that is a sex, age, whether it's a male, female, and all these type of things. Then Dharma and Jati, here in this case is a Hindu, which gives an idea that whether based on that, many times based on Dharma and Jati, we can try to conclude that there will be type of his food habits and food patterns and everything can be understood. And of course, his Sikshana means it's his what you call education qualification. In this particular case, he was a graduate, and business is doing a cloth business, and is located in Shimoga. Then what was his presenting complaints at the time when he came to me? It was a dry scaly lesions on the lower back associated with itching since many years. So this is his complaint: dry scaly lesions on lower back associated with itching since many years, and the lesions are having irregular margin and shape, and some patches are itchier. So he is having a very discrete patches here and there on the back and even the lower limb and everywhere, but it is irregular in shape. It is no regular pattern or uniform pattern. On scratching, the scales easily peels off, leaving behind reddish bleeding spots, and many patches were itchier. So that itchy patch, many times on scratching, it leaves behind the scales easily and becomes a bleeding spots. And also he has a low appetite and a constipation since many months. And he also has painful bilateral ankle joints associated with swelling since 7 years. So 6 to 7 years since that, it's having continuously, there is an aggravation of these conditions. So when I took the details of his, and then he said that he was very almost normal up to 25 years of his age, but later fine day he developed some skin lesions on the back as a spots with itching, and of course on the both the anterior tibial surface bilaterally. He thought it's an allergy, and he took some antihistamine tablet over the counter, and that temporarily got relief. But since then, every year, it is slowly the lesions are getting aggravated, and particularly during stressed out times and winter times. So during those times, usually his condition is becoming worst. So this is what is previous things, and then Purva Chikitsa treatment history. Since last 6 years, he has taken several medications as condition is continuously aggravating. So of course, sometimes partial benefits and sometimes no benefits. Then Kuladattanta, any family history supporting, nothing significant, as all the family members are said to be healthy as per his conditions, his history. Then of course, it's a presenting complaint is a very dominantly a skin disease. So I straight away went into for skin pariksha, the Twacha pariksha. Then first thing what we need to understand is Varna. Wherever that lesion is there, what is the Varna of that lesion? So we have got many words which we use in our classical text, that is Krishna, Shweta, Tamra, Aruna, Neela, Rakta, Pita, Harita, Shyama. These are the varied colors of black, white, coppery red, and even bluish or even reddish or yellowish or greenish, something like that. So all these type of color has been mentioned. So in this case, what are the things I could identify? I have highlighted with yellow. I have highlighted with yellow color. That is, in this case, the Krishna lesions were a little bit blackish, and some places it was tamra or with a tinge of tamra. And of course, when the person scratching it and leaving it off leads to rakta varna. And of course, at some places where there is no itching and lesions are not scaly, and they are turned into Shava Varna. So it's a variegated color of Krishna, Tamra, Rakta, and Shava. almost you can say it Mishra Varaniya. So when the color comes like this, and when these things, Krishna, Shyava, Rakta, Tamra, all these things are there, we can analyze from these that the dosha involved is either Pitta or Vata. So these are the at first level. Then comes Vistara, how much it is spread. It is a Madhyama. When is compared to entire is body area, if we check it up, the extension of the spread, it can be taken as Madhyama. Okay, because Alpa Vastu, Madhyama Vastu, Maha Vastu, we say it's Madhyama, somewhat okay. Then what are the sthana? Where it is actually spread all over the lower back, both the legs, below the knee joint. So it is entirely in those areas. Then akara, what is the shape? It is a discrete, variegated, irregular margin, no uniform shape. So it is typically of that nature. Then swarupa, what type of vrana or something like skin condition is it? It is ruksha, khara, parusha, very hard to touch and very powdery in nature and dry in nature, and sputana yukta, cracks are also seen. So it's a nature of skin. So if you observe that, so it's very clearly khara, parusha, ruksha, sputana. Typically vata, all the qualities are generated due to vata. Then any pidaka varnana is there. In this condition there was no pidakas, so there is no question of any pidaka varnana. So further moved on to that. Then comes sparsha. By touching, is there any changes are there? It is Ushna Sparsha or Shita Sparsha. So in this case, it was Shita Sparsha. There is no inflammatory signs or Ushnata was not there. And Vedana Purna, there are little bit of pain was there because he used to scratch and that area becomes bleeded and the minute ulcerations, and of course some are infected. So that's why there will be pain. Then comes that what type of pain? Pain is alpa. It is not a tivra or madhyama, it's only alpa. So then comes what the category of pain, whether it is toda, beda, cheda, vedana, pidana. In this case, the patient was unable to describe what type of pain it is. So he said there is a pain. So I kept it as it is. Then there is no daha in this case. And srava, when he continuously scratches it, then there is a little bit of srava, that is rakta srava. So that is nothing but any other srava due to disease. It is only after scratching it yields in a bleeding. Then what type of quality of the srava? It is only alpa srava. It is not madhyama srava or bahu srava. It is not excessively oozing. It's only fine bits of hemorrhages. Then of course in this case there is no question of any gandha. And of course kandu. This is one of the important symptom for this he has come. It was a itching. Tivra. Kandu is tivra itching. So it is severe. And kanduttara raktasrava. When there is a kandu, he goes on scratching it and there will be bleeding. Then comes any other lakshanas. Then asvedana was the one thing. In this type of patient, we see that perspiration takes a back seat, and usually perspiration doesn't take place in a prominently normal way. So the patient will always say there will be no sweating as such. So these are the lakshanas and these things. So then based on this, what may be the samprapti vigatana, what we can do it. So very typically when you observe the lakshanas, it is a vata, there is a gunatmaka vruddhi, ruksha is there, parushata is there. So it is two important characters of vata. Then similarly, there is a gunatmaka vruddhi of kapha, which leads to kandu, and of course shita. These gunas are there. So when you look at these ruksha, parusha, kandu, shita and all these things, very typically it is vata, kaphaja, tvakvikara. We can take it as. Then what is the srotas involved? Rasa, that is tvak, rakta and mamsa. These are the areas where we are getting the information. Then dushya. What are the targeted tissues which have been hampered with these doshas? This is rasa, rakta, sweda, lasika. These are the areas, lasika, sweda, rasa, rakta, these are hampered. Then what can be the sroto dushti? We can take it, here we can take it as sangha. There is no ati pravrutti and there is no vimarga gamana, and it is a typical type of blockage for the Vata and Kapha, so it can be taken as Sangha. Then what is the Mala which is involved? The Sweda is involved because it has to come out, but it is not coming out. So that is a Sweda. Then Udbhavasthana, if you think about from where it is happening, the Udbhavasthana is Amashya, because it is been whatever the food he consumes is, and the condition is starting in the form of Ama from the Amashya, and it is Vyaktasthana is Tvak, means skin conditions. And Vyadhi Avastha is, as his own history tells, many years. So it is a Jirna Vyadhi, a chronic disease. Then what is the Vyadhi Marga? It is typically a Bahya Roga Marga. Then any Upadravas are there. Yes, he was having Sandhi Bandhana and Sandhi Ruja. Then what may be the Vivachedaka Nidana? Looking at these Lakshanas and all these things, we can think that it is Kitiba Kushta, Eka Kushta or Mandala Kushta. But Mandala Kushta comes under Mahakushta and it is Mahasravi, so it cannot be Mandala. Kitiba Kushta is a Kina Parusha, this one powdery material will be there. But here Eka Kushta suits Asvedana, Mahavastu and Kanduyukta. So if you to look into these things, I make this as a Vyadhi Vinishchaya as Psoriasis or Eka Kushta. Asvedana, Mahaswatu, Mahavastu and Kanduyukta. So very typically it is Ekakushta. Then other lab investigation in this case was his hemoglobin was 11.5 grams. Definitely when a patient of a chronic skin condition will tend to lose some this one, and even his body, we have observed that hemoglobin level will be somewhat below the normalcy. And another important thing was his RA factor was positive. His RA factor was positive, and ESR is 48 mm per hour and the CRP is 18 mg per liter. So when you look into this factor, RA factor positive and psoriasis, if any modern diagnostic has to be done, then it is called as usually psoriatic arthritis. So usually it is called as psoriatic arthritis. So anyhow, in this case, Patya and Apatya, definitely Supachya, a very easily digestible material, Agni Vardhana, one which simulate the Agni, such Ahara like rice gruel, khichdi, dalia, dal, these basic foodstuffs which across India we use it, that should be taken care and that should be used without any much masala and oil into that. So this is Patya for these patients. And of course, Divasopna and Ratri Jagarana, both are Apatya to this patient. Divasopna is day sleeping, Ratri Jagarana is night awakening. Both are not acceptable and it is Apatya to these type of patients. Along with that, all deep oil fried items, maida items, fermented items or spicy foods, all these to be avoided. Even the non-vegetarian diet. Here, there is a assumption, how can we in the Western world where is a non-vegetarian diet is the staple diet, how can we do it? Of course, I do agree with that, but there are way of making non-vegetarian foods. What I have seen in Indian conditions, most of the non-vegetarian stuffs are cooked in such a manner that excess spice and oils are mixed into that and it is made at a hot spicy things, and such hot spicy non-vegetarian diets are not at all suitable for this condition. Whereas in European and American presentations, sometimes some raw meat is also some with smoked or some baked in along without putting any masala and anything to that. That can be taken care of. That depends on the area and location, and of course the food habits of those patients of that area. Has to keep in mind with Yukti, you can analyze whether to give or not to give. So in this case, in the Indian conditions, I have said not to take non-vegetarian foods, as well as even the eggs, pickles, fish are to be avoided. And any whey protein, cheese, curd, yogurt, they are also apatya because they are all abhishandi karaka and they increase the kandu and even this one. Then comes the part of it, as I have decided the psoriasis or the ekakushta treatment part, shodhana chikitsa, because it's a chronic condition, there is a dosha dosha is of much of higher quality or the maximum vitiation is there. So I have suggested the patient to go for vamana chikitsa. So in that Vamana, there is a Purva Karma, Abhyantara Snehapana. We have suggested him for 7 days in an increasing order, approximately 200 to 250 ml of oil. Grita is consumed. In this case, I have used Panchatikta Gugulu Grita. Started with 20 ml in the morning and goes on increasing day by day, depending upon his capacity to digest it, and followed by empty stomach. In that, Ushnajana Pana is also given. Panchatikta Gulugruta started 20 ml net quantity, 200 and 250 ml in 7 days totally, roughly in 7 days. Then comes Bahya Snehana. So Abhyanga with Kutaja Taila and Bruhad Dantapala Taila, we have used this one for 7 days. Then followed by Bashpa Sweda for 7 days. If one sitting, it is just 15 to 20 minutes per session, not more than that. Then comes Pradhana Karma on the 8th day, Akantapana with up to the neck full. I used to go with the Estimadu Fanta and sugarcane juice plus milk as a combination and a rotation, full capacity. Then in between, we may usually give a kalka, which is prepared out of madanaphala, honey, and saindavalamana combination. Of course, even sometimes vacha is also added to that. And this will induce a typical vamana, maybe for 5 times or 6 times or 10 times, depending upon what are the type of shuddhi we need to get, whether it is a pravara shuddhi or avara shuddhi or madhyama shuddhi, accordingly. Then after the proper vegas are over, then usually we go for Haridra and Gugulu Grita Dhumrapana. For the Shesha Dosha Nirahana, that purpose we used to usually do it because it will give a very clear cut suppression to the kapha, which leads to itching conditions. When we do this one, automatically things will be settled down. Then comes a Paschat Karma on the 9th, 10th, and 11th day usually. Depending upon the Agni of the patient, we use it Manda, Peya, Vilepi, Yusha, Kichidi in Samsajana Karma as per the Agni. This Manda is totally rice water. Mande ka rahito, sikte ka rahito manda. There will be not even a single sikta in that. Peya is sikta samanvita. It is a very watery gruel. Vilepi is also comparatively much thicker. Like that, we make a person to use this type of preparations one by one, depending upon the Agni Kala and Agni. Then after once he attain normal Agni capacity and he can be able to consume the normal food, then we follow the Shamana Chikitsa. So in this Shamana Chikitsa, I have opted for this capsule Proskin 202 before food, then Guguratitta Kashaya 10 ml thrice a day after food, Kadirarista 15 ml thrice a day with equal quantity after food, then capsule Atrisor 202 after food, then Kutaja Taila and Brad Dantapala Taila as external application, and Soralin soap for bathing. So this gives a totally package of treatment and a total protocol. And usually with these things, the patient settle down within a 1 month will get very convincing results, as well as even a patient, he will also satisfied and itching will be reduced. And this case, particularly which I discussed now, is in treatment under my treatment for this condition since last 10 years. I hope so. And of course, every winter a little bit aggression will be there, and he go for particularly he comes with the Sharad Ritu every time one Virechana he takes, and sometimes in Vasanta Ritu he takes one Vamana, and he goes on managing, and he is a very Bishak Bashya patient, and is now the conditions are at most settled, and occasionally now and then he gets some itching, so but it is manageable. So this is the way we can treat any condition with certain pro concepts of Ayurveda, which is explained, and of course very wonderful drugs which have been explained in Ayurveda.
Thank you very much, sir. Lot of lessons to learn there. So first one is that you have kind of a definitive framework. So that will help to cover important points, not to forget the points. So having headlines and subtopics well written ahead makes us to think clearly which dosha is getting aggravated, which are the dhatus, etc. So that becomes very important, sir, to have these headings in a model case sheet.
Definitely, if all these It's what usually I follow in case of skin diseases, which one of the case sheet I have just given for you because it is a handwritten case sheet. I made it just typed for you people. Otherwise, it will be in a handwritten thing. Everything will be in this format. So this gives us a very clear idea that where to go, what should be concentrated, and what should be taken care of, and how to document the things, and how to that document has to be presented. That gives an idea of course, there is a still lot of scope is there to improvise these case sheets also. One can even improvise based on their requirement.
Yes, and another interesting thing that the history of previous illness and all, like you have written it very detailedly, elaborately as if a story, so that it will be recorded, and whenever we need, we can go back and read it and understand. Sometimes I make this mistake of like writing in a kind of code language in using shortcuts. Sometimes I forget, why I have written what I have written. So clear sentences, patient has explained. So, recording the, history of previous illness and family history and all, it gives a lot of hint towards right diagnosis and right approach for treatment.
Definitely, this is a basic thing need. We have to make it because whenever we come across so many people, scientific community, the basic opening statement what we observe about our science is pseudoscience, and then comes the important thing is that when poorly documented, we don't document our cases. Because of these bombardings I have received through my education time, I have made myself that it has to be documented. So I try to, whenever I get it, particularly skin cases, I'll take a photographs and I'll keep on uploading and keeping in my drives, and that gives me a very good confidence. Even I have many times when I taken with the date will be there, and I'll check with the new and compare it then very clearly, which suggests that how the things are changed over a period of 15 days or 1 month, 2 months or 5 years. So all these things are very interesting, and definitely it is an important medical evidence that we need to keep. Everybody has to follow this, then that will be definitely giving a good scope for establishing our science in a present scenario and present situations.
And also in a typical case of like psoriasis, as in this case, how frequently would you go for Vamana Virechana? Like once in a year only, or once in 6 months? How frequently, sir?
Usually, once a patient approaches me for the first time, I'll go one or the other variety depending upon the Lakshana, which is very highlighted in that particular visit. So based on that, if it is a severe Kandu is there, then I will go for Vamana. If it is dryness is there, severe dryness and all is there, then I won't go for any of the Shodhana karmas. Many a times, if there is a redness and tamravarna and pustules are also associated with that, in such conditions, I'll go for virechana. That is one my thought process and of how I do it. Then second thing is, many a times it so happens that a patient approaches to me in a particular time of a year. So based on that particular time of a year, I select the Shodhana procedures. If the patient approaches during Vasanta Rutu, whatever may be the condition, then if it is suitable, then I'll go for, if it is a Vamana Yogya Purusha, then I'll go for Vamana Karma. And the patient reaches to me during Sharad Rutu and patient is Virechana Yogya, then I'll go for Virechana preparations. And many a times the patient may not be sufficiently strengthful, and even sometimes maybe financially not sound, maybe not interested for Shodhana Karmas, but want to get rid of the itching and all those things. Then they'll ask for, sir, you just give me some medicine for a time being. Let me take a decision to go for Shodhana or not in future. Then straight away, many a times I go for Shamana Karmas, Shamana Aushadis. All these things are there. Of course, that depends on what type of patient mentality and their financial capacities, and everything will count.